Fu, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross, page 167, part 3, Interrelationships. Chapter 14, Zang Fu Interrelationships. The main emphasis of this book is to see the Zang Fu in terms of interrelationships. The foundation of all interrelationship in traditional Chinese medicine is the division into yin and yang and the continual process of change and transformation consequent upon it. The main components of the changing patterns of health and disease are the substances, Jing Luo, Zang Fu, and tissues, and the disease factors with which these interact. Each Zang Fu is a system of functional interrelationships, and the 12 Zang Fu together are responsible for the formation and transformation of the substances, and their transportation inside and outside of the Jing Luo system to the tissues and all other parts of the body. In addition, the Zang Fu are responsible for the interaction between the individual and the environment. This involves not only the intake of nourishment and the expulsion of waste, and the balance of Wei Qi and external disease factors at the surface of the body, but also the interplay between the environmental stimuli, and the behavior of the individual. Yin Yang. The Yin Yang interaction is primary basis of all Zang Fu interrelationships. In disharmony, the two basic patterns are the relative deficiency of yin and the relative deficiency of yang. Since Shen is the foundation of yin and yang in the body, deficiency of yin or yang of any other Zang Fu tends to originate with or be associated with deficient Shen yin or deficient Shen yang. Deficient Shen yin, deficient Gan yin, deficient Xin yin, deficient Fei yin, deficient Wei yin, deficient Shen yang, deficient Qi yang, deficient Xin yang. Although, theoretically, every Zang Fu might have yin deficiency, those Zang Fu which, because of their nature, have a special tendency towards it are Shen, Gan, Xin, Fei, and Wei. It is therefore these Zang Fu which have yin deficiency as one of their listed patterns of disharmony. Similarly, every Zang Fu might have yang deficiency, but in practice, because of their natures, only Shen, Qin, and Xin have yang deficiency as one of their listed disharmonies. Substances. The formation, transformation, and transportation of substances within the body depends on the harmonious functional interrelationships of the Zang Fu. The nature, metabolism, and pathology of the substances have been discussed in Chapter 3, and some of the Zang Fu interrelationships involved have been investigated in Chapter 12 on Sanjiao. In this context, the substances can be divided into two groups: Qi, Xue and Jin Ye, Jing and Shen. Qi, Xue and Jin Ye. Under the transforming action of Qi, the food and drink received by Wei is converted into two fractions, pure and impure. The pure fraction includes Gu Qi and fluid vapor, which rise upward, under the influence of Qi and Shen Yang, to the chest, with the involvement of Xin and Fei, and the pure Qi of air. The Gu Qi is converted into Xue, Zong Qi, and Chen Qi. Zong Qi accumulates as the Qi of the chest, and Chen Qi manifests as Wei Qi and Yin Qi, which circulate around the body. The fluid vapor is dispersed as Jing and Ye by the action of Wei, both through the skin and muscles, and throughout the body. When the fluid vapor becomes impure, it is liquefied by Fei and sent down to Shen, where the purer part of it is vaporized and sent back up to Fei, and the less pure part sent to Pangwan for processing and elimination as urine. The impure fraction produced by P moves down to Xiaochan and Dachan. The purer fractions are reabsorbed, and the impure solids expelled as feces. Part of these impure fluids are sent to Pangwan. The transformations that occur in Xiaochan, Dachan, and Pangwan, and the transportation between these systems are motivated by Shenyang. Fei governs the movement of qi around the body, and Xin governs the movement of xue. The movement of Jing Ye involves Shen, Fei, and Pi. All movement depends on Yang, and therefore on the sufficiency of Shenyang. It is a function of Gan to ensure that this movement is smooth and even, and unobstructed. Jing and Shen. Whereas a number of Zang Fu are involved in the metabolism and movement of qi, Xue and Jin Ye, Jing and Shen, each relate primarily to only one organ system. Also, both Jing and Shen have a prenatal component and are hence more precious and less replaceable than the other substances. Although Jing and Shen are active throughout the body, Jing is stored in Shen and relates specifically to Shen physiology and pathology, and Shen reside in Shen, to which it has a special relationship. Pathology of the substances. The pathology of the substances will be considered in terms of each of the Zang systems. Shen. Shen tends not only to patterns of deficient yang and deficient yin, but also to deficient jing. In addition, since Shen is involved in holding the qi sent downwards by Fei, Shen disharmonies may involve asthma or shortness of breath. And since Shen is involved in Jing physiology, Shen disharmonies may involve edema or urinary problems. P. Deficiency of Qi or Yang may result in poor transformation and transportation, and hence inadequate supply of Qi and Xue, an accumulation and stagnation of turbid Jing Ye with possible condensation of phlegm. Also, deficiency of Qi and Yang may be linked with the inability of P to govern Xue, associated with hemorrhage, especially in the digestive system and lower body. Gan. Depression of Gan Qi may lead to stagnation of both Qi and Xue, and deficiency of Gan Yin may be associated with hyperactive Gan Yang. Both depression of Gan Qi and deficiency of Gan Yin may develop into blazing Gan fire, which, if then associated with flame and rising Gan wind, may obstruct the orifices of Shen, with disturbance of Shen. If Gan loses its ability to store and regulate Xue, or if Xue becomes heated with blazing Gan fire, then Xue may leak from Xue Mai and hemorrhage may occur. Shin. Shin is involved in the formation of Qi and Xue in the upper jiao, but its main functions are moving Xue through Xue Mai and storing Shen. If there is insufficient Xin Qi and Xin Yang to move Xue properly, there may be local deficiency or stagnation of Xue, with coldness, cyanosis, or pain. If there is insufficient Xin Yin and Xin Xue to provide residence for Shen, Shen may become disturbed, especially if there is accompanying fire and phlegm in Shin. Fei. Fei is involved, along with Shen, in the formation of Qi and Xue in the chest, especially since it is responsible for respiration. However, Its main functions are dispersing and descending of qi and jin ye throughout the system. Fei deficiency and qi deficiency are closely interwoven. Failure of the descending function may be associated with asthma and shortness of breath. Failure of the dispersing function may involve lowered resistance to invasion of the body by external disease factors. In terms of Jing physiology, failure of the dispersing and descending function may lead to edema and to retention and stagnation of fluid throughout the system. Although impairment of dispersing and descending functions are largely associated with insufficient Fei Yang to move the Qi and Jin Ye, they may also be associated with deficient Fei Yin and the accumulation of heat in Fei. Jing Luo. The substances which are formed and transformed by the Zang Fu are transported by their action to all parts of the body. This transmission of the substances is via three main systems: Jing Luo, Xue Mai, outside Jing Luo and Xue Mai. These three systems are closely interwoven in physiology and pathology. The Jing Luo system is the primary concern here. Each Zang Fu has its own associated Jing Luo system. The main channel with its superficial and deep pathways, and the tendinomuscular, divergent, and Luo systems. The Jing Luo system of a particular Zang Fu connects the organ system to its paired Zang or Fu, to its related tissues, orifices, and areas of the body, and to the other Zang Fu systems. The Jing Luo systems of all Zang Fu together form a network through which all systems and all parts of the body are in communication, both with each other and with the external environment. It is via the movement of substances through the Jing Luo system that the physiological and pathological interrelationships of the Zang Fu are manifested. Tissues. This heading includes three main groups: tissues, orifices and senses, curious organs. Tissues. The traditional relationships between Zang and tissues are summarized in Table 14.1. Table 14.1 Zang tissue relationships. Zang of Shen rules bones, which manifests in head hair. Zang of Pi rules muscles, which manifests in lips. Zang of Gan rules tendons, which manifests in nails. Zang of Xin rules Xue Mai, which manifests in face. Zang of Fei rules skin, which manifests in body hair. Bones and head hair. Marrow, brain, and bones were discussed in relation to Jing and Shen in chapters 3 and 7 and are considered below under the heading of curious organs. Teeth. Bones and teeth. The excess of the bones are ruled by Shen. Hence, deficient Shenjing may manifest in premature looseness, decay, and loss of teeth. And deficient Shen-yin may give the teeth the appearance of dried bone. However, dryness of the teeth associated with dryness, redness, and swelling of the gums may be a sign of heat in Wei, since Wei Jing Luo is distributed to the gums, or it may be a sign of deficient Shen Yin with fire blazing upward. Head hair. The hair of the body is said to be ruled by Fei, and the hair of the head is said to be ruled by Shen. Various factors combine to ensure a healthy head of hair, but Two of the most important are a sufficient supply of Jing and of Xue. Deficient Jing and deficient Xue may be associated with dull, dry hair, or with premature graying and hair loss. Abnormal hair loss, for example, may be associated with a variety of factors, including severe shock, chronic stress, malnutrition, and drug and radiotherapy. In treatment, it may be necessary not only to strengthen Shen and Pi in order to strengthen Jing and Xue, but also to pacify Xin and Yan, to relieve tension and anxiety. The patient should be advised to avoid and reduce stress wherever possible, to reduce workload, especially of study, to get as much rest and relaxation as possible, and to take care with nutrition, perhaps taking a complete vitamin B complex to strengthen the nervous system, and iron supplement to strengthen Xue. It is clear from this It is clear from this that Shen is not necessarily the only or the most important factor affecting the health of head hair. A variety of different factors may be invoked, depending on the situation. Muscles and lips. The main area of confusion here is between the muscles or flesh ruled by Pi and the tendons ruled by Gan. This is due to the fact that the Chinese terms, translated as muscles and tendons, do not correspond exactly with the Western concepts of the same name. Either Chinese term may refer to muscles, ligaments, and tendons, but the use of the term muscles implies involvement of Pi, and the use of the term tendons implies involvement of Gan. Pi rules the muscles, the flesh and the forelimbs, since Pi is responsible for the formation of the Qi and Xue that nourish and moisten the muscles. However, the Xue available to the muscles is also dependent on the ability of Gan to store Xue, so that either Pi or Gan imbalance may result in poor supply of Xue to the muscles. This situation is further complicated by the fact that imbalance of Gan and of Pi commonly occur together. For example, depression of Gan Qi may depress the transforming and transporting functions of Pi, resulting in the aggravation of the deficiency of Qi and Xue. The lips are discussed along with the mouth in this section on orifices. Tendons and nails. Gan is sometimes associated with the contractile aspect of muscles, ligaments, and tendons, whilst P is sometimes associated with their bulk and strength. Thus, Gan imbalance is more associated with spasm, contraction, and spastic paralysis of the muscles and tendons. As in windstroke patterns, for example, CVA sequelae, wrist P imbalance is more associated with weakness, wasting, and atrophy of the muscles and tendons, as in Wei patterns, for example, myasthenia. However, according to Dr. Su Xinmin, there is no clear distinction between muscles and tendons. In Wei patterns, for example, polio, it would not be enough to treat P alone. Points of both P and Yan and Dan should be used. For example, Yang Ling Quan, gallbladder 34, might be used for slack muscles due to the close relationship between muscles and tendons. Nails. An adequate supply of ganshui ensures that the nails are pink and moist. If ganshui is deficient, the nails may become thin, brittle, rigid, and pale, perhaps with white spots. Inability of Shen to move Xue to the extremities, and impairment of formation of Xue by Pi may also affect the health of the nails. Xue Mai and Face. Xue and Xue Mai were discussed in relation to substances in Chapter 3 and in relation to Xin in Chapter 10. They are also briefly considered in the section on curious organs below. Xue is affected by disharmonies of all of the five Zang, as shown in Table 15.3 on page 189, and Xue Mai may be affected by disharmonies of both Xin and Fei, since the movement of Xue in Xue Mai is so closely linked to the movement of Qi. Face. The face or complexion is ruled by Xin, as mentioned on page 124. However, many other disharmonies besides those of Xin register in the face. Deficient Xue, linked with deficiency of Gan or Pi, may show a dull pale face, and deficient Qi and Yang may give a bright pale face. The whole face may become red in conditions of excess heat or blazing fire, or there may be malar flush in conditions of deficient heat or deficient yin. Dump heat in Pi or in Gan and Dan may result in a yellow, orange, or greenish complexion, and stagnation of Xue may be associated with hues of blue or purple. Skin and body hair. The exterior of the body, the skin and the body hair is said to be ruled by Fei. However, many factors, external, internal, and miscellaneous, affect the health of the skin. The skin and the surface of the body, including the superficial Jing Luo, may be invaded by wind, cold, damp, dryness, heat and summer heat, in various combinations. Internal disharmony also affects the skin. For example, phlegm may obstruct Jing Luo, forming subcutaneous lumps which raise the surface of the skin. Swollen, swollen and puffy skin may be a sign of edema associated with defective Jing Ye metabolism, linked with disharmony of any combination of Shen, Fei, Pi, Wei, Xiaochan, Dachan, Hangwan, and Sanjiao. Alternatively, dry and with red skin may represent deficient Jing Ye and or Xue, and fluid-filled eruptions may be a sign of dump. Pallid skin that is loose and flaccid to the touch may be associated with deficient Qi and with age. Skin color may be associated with various disharmonies, as mentioned in the section on the face above. Heat may be associated with redness of the skin, as in longer exposure to wind and sun, and with red eruptions or rashes. The latter are seen in TCM as heat in Xue and may derive from many factors: inherited predisposition, side effects of drugs, excess warming food or herbs producing heat in the body, exposure to external wind and summer heat, emotional and mental irritation, etc. Greasy skin and body hair may be linked with excess consumption of rich, greasy food or with impairment of function of Zang Fu associated with digestion. Pi, Wei, Dan, Xiaoshan, and Achan. Greasy skin may be linked with heat in Xue and is often accompanied by red, pustular eruptions associated with damp and heat. In summary, Fei disharmony is only one of many disease factors affecting the skin, and the origins of disharmony in any patient with a skin problem must be fully understood before treatment. For example, in one patient, the following factors were combined together. There was an inherited tendency to itchy red skin rashes, to emotional tension, and to premenstrual tension. The skin condition was worse before a period and was aggravated by emotional tension, various cosmetics, alcohol, and by sugary, rich, and greasy food. Treatment aimed at removing heat from Xue, pacifying Gan and Shen, and strengthening Yin. The patient was asked to moderate her consumption of alcohol, avoid sweets and rich, greasy, spicy food, avoid conflict situations, and to try to reduce stress, and to experiment carefully to determine which cosmetics and shampoos were safe for her. Body hair. Just as Shen manifests in the hair of the head, they manifest in the hair of the body. However, as described in the previous section of skin, they is not the only factor affecting body hair. Orifices and senses. There is considerable overlap of concepts between tissues and orifices, for example, lips and mouth, and between orifices and senses, for example, ears as orifices and ears as senses. Obviously, the healthy functioning of the sense organs and orifices depends on all the Zang Fu working together in harmony. However, TCM proposes specific relationships between particular Zang Fu and particular sense organs or orifices. These are summarized in Table 14.2 and will be considered below under the headings of the five Zang. Table 14.2 Zang orifices relationships. Shen is relationship with ears. P relationships with mouth. Gan relationships with eyes. Xin relationships with tongue. They relationship with nose. Shen and ears. The upper orifices or sense organs ruled by Shen are the ears, and the lower orifices ruled by Shen are the urethra and anus. However, according to Polkart, the ears are governed by both Shen and Xin. And since all Jing Luo are said to connect to the ears, various Zang Fu disharmonies may affect the ears and the sense of hearing. In pathology, fire in Gan and Dam may generate phlegm and ascend to the head to disrupt the senses. The channels of Dan and Sanjiao have links with the ears and are often used in the treatment of ear problems. Indeed, the following may be used as the main points for tinnitus. Ethan, triple Barna 17, Chunchu, triple Barna 3, Erman, triple Barna 21, and Fenchi, gallbladder 20, and are exclusively from Dan and Sanjiao channels. P and mouth. P opens into the mouth and manifests in the lips, so that P can distinguish the five flavors, and so that the lips are red and moist. Insensitivity to taste is generally associated with P, and not with the disharmonies of Shin affecting the tongue. Shin controls that aspect of the tongue concerned with speech. However, pale lips do not necessarily indicate a chronic disharmony of P. They may also indicate a sudden, severe hemorrhage, deficiency of Xinxue, or inability of Gan to store Xue properly. Also, lips that are dry and cracked may indicate not only fire inlay, but also febrile diseases in general. Bluish or purple lips may indicate both deficient Yin Yang and stagnant Xinxue. Gan and Eyes. All the Zang Fu contribute to the brightness of the eyes, and Shenjing nourishes the eyes as well as the ears. But traditionally, The specific relationships is with Gan. If the eyes are bright and vital, Shen and Jing are healthy. If the eyes are dull and lifeless, it may indicate general deficiency of Qi and Xue or deficiency of Shen and Jing. Redness of the eyes is associated with heat, whether from external invasion or from internal disharmony. Redness with exudation may indicate accumulation of damp heat. Exudation without redness or muddiness of the whites of the eyes may indicate damp and deficient Qi. Puffiness or bugginess under the eyes may indicate deficient Shen-Qi, and so on. However, treatment of eye diseases will depend on their nature and origin, and the points used will also reflect those channels which have links with the eyes. For example, Pangguan, Dan, and Wei especially. For example, conjuncti- conjunctivitis is attributed in TCM to wind and heat, and treatment is directed to dispersing these so that the main points may include Fen Qi, gallbladder 20, Hegu, large intestine 4, and Jingmin, bladder 1. Glaucoma is attributed to deficient Shen Yin, which allows fire and wind in Gan and Dang to ascend. Treatment must therefore include nourishment of Yin with such points as Tai Chi, kidney 3, and San Yin Jiao, spleen 6. Xin and Tongue. Xin opens into the tongue, which may reflect Xin disharmony, but also, of course, reflects the disharmony of all the Zang, and hence is used as a major diagnostic procedure. For example, pale tongue does not necessarily indicate deficient Xin Xue. It may also indicate general Qi, Yang, or Xue deficiency, and a purple tongue is not necessarily indicative of stagnant Xin Xue. It might indicate stagnation due to cold, depression of Ganqi, or injury of Xue and Jin Ye by heat. However, soreness and ulceration of the tongue are often associated with blazing Xin fire, and speech defects or disturbances may be associated with flame fire or flame cold in Shen. Obstructing or disturbing Shen. The treatment for slurred speech, for example, includes points from Xin and Xinbao channels. Fei and nose, throat and voice. Fei opens into the nose. Also, the throat is the door of Fei and the residence of the vocal cords. Although disharmonies of Zang other than Fei may affect the nose, since the nose is the interface between Fei and the external environment. The nose is often involved when Fei is invaded by external factors. Nasal disorders may be treated with local points, for example, B-tongue, MHN14, in-tongue, MHN3, and in-shan, large intestine 20. Hegu, large intestine 4, may also be used since it is a distant point on the same channel as in-shan, and especially since it disperses external wind conditions. Thus, the main points used in treatment of acute rhinitis and chronic sinusitis do not include points from Fei channel, but points such as Li Eshe, Lu7, lung 7 may be used in a supplementary capacity if heat is accumulated in Fei. Sore throat may be associated with various patterns, and Fei will only be treated if Fei disharmony is invoked. For example, in acute tonsillitis, where Xiaoqiang, lungs 11 is bled to disperse heat in Fei. A weak voice with little desire to speak may be part of a Fei Qi deficiency pattern, but is not a common presenting sign. Weakness of voice due to deficient Fei Qi is a separate phenomenon from disturbance of speech due to disharmony of Xin and Shen. Curious organs. The 6 curious organs are bones, marrow, brain, uterus, Xue Mai and Tongue. They are said to resemble the Fu in form because they are hollow, and the Zang in function because they store and do not excrete. These tissues, in their aspect as curious organs, have relatively little theoretical or practical importance and are generally treated via other systems. Marrow, bones, and brain. The yin aspect of Jing gives rise to marrow, which may either form the brain, the sea of marrow, or bone marrow, which may contribute to the formation of Xue. Since they are formed from Jing and are maintained by it, all are governed by Shen. All may be involved in the pattern of deficient Shen Jing, and all may be treated using points which strengthen Shen function. In TCM, Shen is the seat of consciousness, since it is the residence of Shen. However, the brain, and hence Shen, have a small part to play in behavior, since the brain is responsible for fluidity of movement and of the senses of hearing and of vision. If marrow is deficient and brain is not nourished, or if the orifices of the sense are obstructed, there is poor vision and hearing, dizziness, and perhaps lack of consciousness. This contrasts with the disturbance of Shen caused by obstruction of orifices of Shin, which is accompanied by insanity and disorders of speech. However, in certain conditions, for example, mental diseases, obstruction of both Shin and senses may occur together. Uterus. The uterus is the organ central to the two processes of menstruation and gestation, which are chiefly dependent on the systems of Renmai, Chongmai, Shen, Pi, and Gan. Disorders of the uterus, that is of menstruation or gestation, are mainly treated using points on one or more of these 5 channels. Xue Mai. There is no clear distinction between Xue Mai and Jing Luo. Both systems carry both Qi and Xue. It may be that the Xue Mai contain relatively more Xue, and Jing Luo, other than Xue Mai, contain relatively more Qi, but in any case, although the Chinese texts devote many pages to the details of distribution of the Jing Luo, they do not detail the distribution of Xue Mai separately. Although the basic units of acupuncture treatment are upon the superficial Jing Luo, not upon Xue Mai as a separate system. Xin rules the movement of Xue through Xue Mai. Pi holds Xue within Xue Mai. Gan is responsible for the unobstructed, even flow of Xue within Xue Mai, and for maintaining the correct volume of Xue in circulation. In addition, Zongqi assists Xin in its function. Shen Yang is the foundation for the Yang of the other Zang Fu, and hence for the movement of Qi and Xue, and Shen Yin is the foundation for Yin of the other Zang Fu, and hence cools Xue to prevent it becoming hot and leaving Xue Mai. Dan. The functions of Dan as a curious organ are the same as its functions as a Fu system, which have already been discussed. It is listed as a curious organ, since Unlike others who, it stores a pure fluid, bile.